Joining us now from Bath in the United Kingdom is Dr. Bharat Pankania, a senior clinical lecturer at the University of Exeter Medical School, who has over 25 years' experience in communicable disease control and infectious disease management. Dr. Pankania, welcome to the program.
Thank you. Good morning.
Good morning. Now, how does the recent resurgence of Mpox, which has been declared a global health emergency by the WHO, highlight the growing challenges of managing zoonotic diseases and what can be learnt from past outbreaks to improve early detection and containment?
So we are seeing regular outbreaks of such infections. We've had an Ebola outbreak in West Africa a few years ago. In between, we had an Mpox outbreak, and now we've got another one. What it's telling us about zoonotics is that animal to human transmission occurs when we interfere with the environment in which animals live. And with population increases, more deforestation and more human incursions into forests, and doing things like capturing animals and eating them or storing them near what we call wet markets, etc., we have a zoonotic. And that zoonotic, i.e. transmission from animal to human, and then from human to human, causes all these outbreaks. So this is not going to go away. And this is a biosecurity issue. We have outbreaks and then we buy tons of vaccines, etc. But we do very little with respect to preventing it in the first instance, because preventing is the backroom intervention which doesn't catch the news, doesn't catch the media, doesn't make anybody interested. But that is a lot cheaper, and we could do very well to prevent these zoonotics, which then become human-to-human communicable diseases.
Okay, so in light of the information you've just shared there, the tempering with the animals' natural habitats is only just increasing. So according to that, we're looking at seeing a lot more diseases coming about.
You're absolutely right. And when I teach my students at University of Exeter, we say exactly this. With global warming, climate change, incursions into forests, deforestation, we will see more and more of re-emergence and emergence of exotic illnesses from interactions by humans with animals.
Okay. All right. Now, given the rise in human-to-human transmission of the Mpox and the heightened risk in regions with limited healthcare infrastructure, how are global health organisations and local governments coordinating efforts to strengthen healthcare systems?
So it's a struggle, especially in the DCR, where there is already a civil war and there's war with other neighboring countries. It's very difficult. And unfortunately, with international travel and trade, what starts off in the DCR soon spreads to neighboring countries. And then from neighboring countries, it spreads globally. So it is in the interest of richer nations to help countries like the DCR to control and contain it locally. It is in our own Western countries' self-interest to supply the vaccines en masse, and also supply the logistics so that all these control containment measures can be implemented locally. And of course, long-term, pay attention to biosecurity with regards to the zoonotics.
Okay, now in light of the evolving nature of Mpox strains and their potential to affect internal organs, how can healthcare providers ensure effective treatment and address long-term health consequences?
It's very difficult. The only thing we can do, to be honest, is to have an immunized population. So we have the presence of the virus, we have people who are infected, we have people who are infecting others. And the only tool we have are the vaccines. There are purported to be antivirals which may work, but to be honest, their efficacy is not well proven. So the only thing we can do to protect the healthcare workers and others is to provide them with vaccines.
Okay. Now, how are socio-cultural factors such as misinformation, stigma, public compliance with health measures influencing the effectiveness of Mpox containment efforts? And what strategies should governments and health organisations employ to combat these issues and enhance public cooperation addressing the outbreak?
Yes, you ask a brilliant question, really. And these are big issues in Africa. And what applies to Africa does not apply in the West. What I'm trying to say is that we have cultural differences, and we need to understand African culture, and African culture where people don't want to come forward because they have shame, fear, anxiety, etc. So they have non-health seeking behaviors. They just don't want to know about it, and they don't want to seek help, but they carry on infecting other people and generating more cases. Therefore, you need to have bespoke, in other words, related to Africa, health information programs, so that, it says something like this: if you are ill, there's no shame in being ill. If you are ill, turn up. We will look after you. There's no stigma. There's no punishment. There may be a reward. Please turn up. Let us look after you. It's all those simple messages so that people don't go underground but carry on infecting others. And by the way, this happened during the HIV outbreaks that we used to have, because there was a huge stigma against HIV and HIV even testing. And I find even now, when we have African patients in the UK, their reluctance to be tested for HIV because they fear the stigma of a HIV infection. So there's a lot of work to do in control and containment, and one of them is those succinct health messages.
Dr. Pankania, thank you so much for joining us on the program. It's been very insightful. We appreciate your contribution.
Thank you.